Do vertigo exercises work? We're going to figure this out, and we're going to look at when they may be helpful and when they might not be helpful in this video. Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith, and I not only want to help you figure out what's causing your vertigo, but also how you can recover from it. The best way to get my help is if you hit that subscribe button and the little bell next to it to get notifications on when I come out with new helpful videos. Now, let's break this down by diagnosis and figure out, is our vestibular exercise going to be helpful? Now, first thing, vestibular exercises are meant to help reorganize the brain to process sensory information more efficiently. So our brain utilizes information from the ears, the inner ear specifically, that vestibular system, the eyes, and your feet. So when I say feet, I'm talking about the somatosensory system, which also incorporates signals that come from your muscles and your joints to help give you a sense of where you are in space. So all those systems have to work together to help you feel stable and grounded. If one of them is not working correctly, then you're most likely experiencing dizziness or some kind of instability or some kind of balance issue. So when we're talking about vestibular exercise, we're trying to get the brain to process all that information efficiently. So let's start with the first diagnosis on the list is usually always BPPV, because that's the most common reason for dizziness. Now, vestibular exercises aren't necessarily going to fix this problem unless you're including the repositioning maneuver under that vestibular exercise kind of category. So when I'm thinking vestibular exercise, I'm thinking balance exercises, I'm thinking that times one viewing, the eyes and head exercises, habituation exercises where you're kind of repeating motions. So BPPV, you need a specific maneuver for that specific canal that's involved where those crystals are displaced. If you want help trying to figure out what's causing or which canal those little crystals are displaced in and what the best maneuver may be for your specific BPPV, then check out my Vertigo Kickstart mini course. You can find the link below or in my About page. But fix that first. So you got to put those crystals back where they're supposed to go. Then you can proceed to looking at vestibular exercises to help improve your balance, get you back to normal. And in those cases, vestibular exercises are helpful because you fix the problem and now you just need to help your brain get back to you feeling normal again. And vestibular exercises are going to help. So exercises like turning your head while you're walking, doing eyes closed activities on an unstable surface as long as you're in a safe environment are going to help the brain reorganize information again. So let's talk about the next diagnosis, vestibular neuritis, which often leads to what we call a hypofunction or weakness in one side. So usually it's caused from a viral infection that weakens the vestibular nerve. So it weakens one inner ear, and those signals aren't getting sent to the brain as strongly as the other side. So if you have two signals that aren't matching up, that's going to cause dizziness. Now, vestibular exercises are going to be very helpful for this diagnosis. All the research shows that they're very effective in helping you get back to feeling normal again. And there's two goals that we're trying to do if you have a hypofunction on one side. One is to help restore that reflex, or not necessarily restore, but help the brain compensate for that weakness in the inner ear. And the time zone viewing exercise, where you keep your eyes on a target and you move your head left and right, is very effective in helping that reflex get back to normal. The second thing that we're trying to do is help improve your balance. And those exercises are going to, so we kind of have to help the brain process that information again, help it compensate for that weakness like I talked about, and get it back to normal. So sometimes that's all we need to do. Sometimes we also have to deal with, some problems that might have come on as a secondary cause or result from that hypofunction. So if you have any neck problems, or if you've developed 3PD, which is persistent postural perceptual dizziness from the vestibular injury, those are other things that we gotta talk about, but I'll get to those as well. Now, cervicogenic dizziness, physical therapy again, or vestibular therapy, and more of usually you have to fix the structural problems first. So if there's inflammation, if there's imbalances in the neck, if there's weakness in some muscles or tightness in some muscles, we have to address those problems first. If you go straight into vestibular exercises, sometimes you might be making the problem worse. So if you're just, vestibular exercises depend a lot on head movement. So if you just keep moving your head and you're irritating those structures before you actually kind of fix that problem, then that could cause to a bigger, or just get worse and worse the more you do that exercise. So usually what I'm doing with that is I'm helping people restore their neck function first and decrease the irritation. And then if that doesn't just completely clear up the problem, then we may have to do, and they still have some motion sensitivity, we may be doing some vestibular exercises to help desensitize them to that. Now, the desensitization part of vestibular therapy is going to be very helpful for 3PD, or persistent postural perceptual dizziness, because that's a problem where the brain's not organizing all the sensory information appropriately. Now, a lot of times this is people who have 3PD are going to have difficulty in busy environments, particularly busy visual environments. So a grocery store, looking up and down the aisles, there's all those items, or busy, a crowded area. And the reason is because, one, their brain's having a hard time processing all the visual information. So there's a lot of information coming in through the eyes, and the brain's having a hard time just making sense of all of it. And two, usually these people are, or people with 3PD are prioritizing their vision, the information coming in through their eyes, more than their inner ear. And that's not ideal because the vision is easily fooled. So if you are in a crowded area and you can't find a focal point to visually fixate on, so you can't find something like people always talk about looking on the horizon or looking on a point of the wall to help them keep their balance. If it's just filled with stuff that's moving, then you're not going to be able to visually find a balance point. And that's, in those scenarios, we want to be using more of the inner ear for our balance. That's the system that's a little bit more reliable. But if you've had some kind of injury to the inner ear, and your brain kind of prioritized the vision in the short term and never got back to trusting that inner ear system again, then usually that's when you end up what we call visual dependency. A lot of times that can feed into 3PD and have all this kind of visual motion sensitivity as well, or this kind of rocking swaying sensation that constant rocking swaying sensation that people complain of. And in this case, again, vestibular exercises are going to be important, but you got to pay attention to the pacing with this. So a lot of times what makes you dizzy with this condition is going to make you better, as long as you pace it appropriately. So you're not overwhelming the brain too much. You're just doing exercises to go into your symptoms a little bit, and then you're able to recover within a couple minutes after stopping. Now, if you're having problems like vestibular migraines, or let's talk about vestibular migraines. If you're having an acute attack, exercise is not going to be helpful. The brain's not in a state where it can recover or adapt or compensate or recover from whatever exercises that you're doing. So the vestibular for migraines in that acute attack is not going to be helpful, but when you're out of that acute attack, vestibular exercises are going to be helpful to work on any motion sensitivity or visual motion sensitivity that you may have. They're going to be helpful to improve your balance. So they're going to be helpful to address those kind of secondary problems of what is resulting from those migraines. Now, you're probably going to want to address those lifestyle factors that are maybe triggers for migraines, whether it's dehydration, stress, lack of sleep, diet. Sometimes it may need to be medically managed by a physician. Some medications can help as well. Usually we start with kind of lifestyle factors first before you kind of move into that. But so migraines may be addressed in a little bit different way, but exercise can still be helpful outside of that acute attack to help you restore some of that function that's been impaired. Similar thing to Meniere's disease. You may need to address the lifestyle factors that are triggering the Meniere's. You know, a lot of times it might be diet, might be stress, and then vestibular exercise will be helpful to improve any kind of loss you have in your balance or you know, dizziness outside of those acute attacks. So, and then you got problems like perilymphatic fistula or semicircular canal dehiscence or vestibular schwannoma. That's not going to be necessarily be helpful with vestibular exercises until you've had surgery to correct the problem. So those conditions, you know, you probably want to have surgical intervention for before you start vestibular exercises. As always, you know, discuss this with your medical professional and see what they think might be most helpful for you, because it may differ depending on your situation. But in my experience, you know, those are the most common vestibular diagnoses that are going to be the most helpful, or that vestibular exercises are going to be the most helpful for. So I hope this video is helpful for you. And if you are trying to figure out what's causing your vertigo, check out my free ebook below on the 5 most common causes of vertigo and how to recover from it, or in my About page. And feel free to reach out if you have any questions. Thanks for watching.